Hi, my name is Parker Morris. Alongside Abby Warner and Zainab Kwalabash and Jaime, we did a literature review focusing on microplastics in dentistry. So, microplastics are defined as zero point 0.1 centimeters or 1,000 microns to 1 micron uh, of plastic materials. These, in layman's terms, cannot be seen with the naked eye, must be seen under an optical microscope. The microplastics are of big discussion in worlds of environment and health because of their effects on the ocean and their recent discovery of amounts in the ocean, and along with that, the amounts found in the human body. For this literature review, we were just focusing on articles that talked about the microplastics in dental field and different products that release microplastics. So this is not a definitive list. This is just a small list, a sampling. And some sources include toothpaste, toothbrushes, sealants, orthodontic elastics, aligners, orthodontic adhesives, and composites. Like I said, there is more than that, but these are just some that we in the articles focused on. So our results, some of our results at least. So the toothpaste, an article from India discovered or researched the amount of microplastics released in toothpaste. They discovered that the percent of the product by weight that was microplastic particles ranged from 0.2% to 0.9%. Likewise, toothbrush might released between 30 and 120 particles per brush per day, with particles ranging from 0.1 millimeters to 0.3 millimeters. Orthodontic adhesives were found to release less than 150 plastic or microplastic particles, with different brands releasing different amounts. Composite resins and acrylic resins release different amounts based on the different factors that the researchers were testing. They did it in a controlled environment, not in a human mouth, so they tested specifically how much is released from micro or from brushing, how much is released with temperature and how much is released with pH treatment. And they had different amounts based on the different materials and the different factors that were tested. If you look to your right, you will see a small graph that shows the different orthodontic materials and how much microplastics were released from each of the materials. So this leads to some discussions, which include how much abundance of microplastics is in dental products that are being used, how much are there in different brands of the same products. This also includes environmental concerns, and can they be changed out for more environmentally friendly options like toothbrushes? We have bamboo toothbrushes or something along those lines, and different materials like that I may have not discussed in this video. We also have considerations that could be used for the different products that we use for barriers in the dental office. And some future research that should be considered include how this affects us as patients and as dental professional providers as we pursue a career in the dental field. And with this being understudied and with microplastics starting to become more studied, how the effects of microplastics in the dental field has an environmental effect, what their environmental effect is. So these are our references, these are the articles that we used, and we would like to send appreciation to our mentors at Roseman University and the core offices for the support. So, thank you.